Hello everyone, and welcome to this audio podcast. This is an audio podcast that surrounds a sort of an overview around an important what is deemed as an important subject entity around healthcare, particular groups of healthcare professionals, i.e., healthcare scientists, and being involved in what is known as primary care. And this research actually looks at whether now is the right time for healthcare scientists in primary care. And this research looks at this question, or looks to answer this question by conducting and informing a sort of understanding and context through a what is known as a systematic review. What I thought to do as part of this audio podcast, on behalf of the Renal Patient Support Group, or the RPSG, is to actually highlight this context, highlight the context around this particular poster presentation, which has been accepted for presentation at the International Paediatric Nephrology Association this year in 2022. By providing an overview around this subject, by again giving an overview and highlighting the particular themes that come out of this research, or that came out of this research. So the aims around this work were conducting a systematic review over 18 years, over an 18-year duration. The aims and objectives here really were to describe how CKD patients, or those going through chronic kidney disease, currently receive educational support, and highlight what support pathway for chronic kidney disease could look like with healthcare scientists' involvement, specifically in relating to laboratory parameters, tests, and investigations. And so this work will sought to understand if CKD patients could attain more informed education for disease management. And the work finally sought to make a few recommendations, and also outline again if and now is the right time for healthcare scientists to be involved to support primary care and best practice. So a little bit of background around this work. So healthcare and technology have been advancing, or and dare I say evolving sort of rapidly over the years, and the experience that health professionals and patients, the experience and that health professionals and patients who have become accustomed to using facilities, accustomed to using sort of day-to-day online ways of retrieving information, and harnessing understanding in a way through day-to-day living. With the current main challenges faced by at least in the UK, the National Health Service, or NHS, being costs and declining numbers of general practitioners, or GPs. There is demand. There has been a demand to better utilize involvement by those professionals that are umbrellaed under what are known as allied health professionals, or AHPs. Expanding data collection surrounding CKD or chronic kidney disease would allow more detailed understanding of not only which patients are more suspect or high risk of specific comorbidities, but would also allow opportunities for allied health professionals with knowledge base and expertise to also be involved at the forefront of healthcare. So data integration could pave the way for more transparent for disease management, and smarter screening programs in primary care. So advances around technology or technological advancement is known to have sort of revolutionized many different industries, notwithstanding specific specialties, but many industries, including the bank sector, which has shown to better staff productivity and performance, reduce errors, and increase customer satisfaction. At least in some contexts. Technology has been known to have some set of value as a resource in supporting healthcare, and it can streamline services and efficiencies, improve workflow, and presents better patient reported outcome measures, or also known as PROMs, patient reported outcome measures. This can be identified with the use of different systems, from automated dispensing systems to electronic patient healthcare records. However, it's seen that the healthcare industry, irrespective of sort of whether in healthcare, whether there's sort of those government-based organizations or private, irrespective. However, it is seen that the healthcare industry generally has been slow in the adoption of particular technologies, and so there is and has been considerable room for its development. Its development. Now, I'm now going to talk a little bit about the systematic review approach, and what this research was about in relating to how the systematic review helped inform this work. So a retrospective literature review was conducted over an 18-year duration. A critical appraisal skills program was implemented to identify PACEs methodically. Main words or terminologies were arranged according to a general grouping of terms surrounding healthcare scientists, diagnostic screening, and primary care. There's a couple of tables. There's some tables in this presentation, in this poster presentation, and tables 1 and 2 in this highlight the results according to the list of databases that were used to seek out sort of paper publications. According to a list of databases, and table 3 summarizes what is known as the inclusion and exclusion criteria that either fit within the remit of the terminologies, as well as the works around the main grouping of terms, i.e. again healthcare scientists, diagnostics, screening, and primary care, and exclusion criteria, and those papers works that came out in the search part of the search criteria, but were actually excluded owing to their discrepancies respectively. So a critical appraisal skill program was used to identify papers methodically, and relevant guidelines, frameworks, policy reports were also included, where they were specifically focused on healthcare science and what is known as modernization. And so the themes derived were as follows. So there were 5 themes that were derived from this work, from this literature review, but ultimately in relating to the systematic review. So number 1 was healthcare science and leadership. Number 2 was roles, smarter working and collaboration. Three was theme 3 was CKD, primary care education. 4 was skill mix, and 5 barriers to integration. So I'm not going to say I'm now going to talk a little bit about some context around these different themes. So theme 1, healthcare science and leadership. So owing to the present perception of healthcare scientists, these particular allied health professionals, or AHPs, have largely stayed in the background of healthcare. Healthcare scientists are perhaps required who can integrate between science and disease, bridge gaps in health practices surrounding specific health issues, i.e., for example, laboratory test investigations, blood and organ donation. Healthcare scientists capable of producing first-class science, and how science and how such science transpires to real healthcare require mutual place. Literature informs that healthcare scientists have a wider role in health, with a desire to reach beyond the confines of laboratories and to make healthcare more effective. So research informs actually that healthcare scientists are required who can communicate with makers in society, irrespective of area and scientific specialty. One of the wider responsibilities of such allied health professionals is to provide the public with new knowledge. A healthcare scientist, a leader, also encourage such allied health professionals to have dialogue with their colleagues, and in this remit, those colleagues would be what are known as would be part of what is known as multidisciplinary teams, or MDTs. For example, to highlight when it is safe to, for example, transfuse patients, or who may have a renal insufficiency or kidney disease, for example. And leadership also relates to understanding where patients may benefit with alternative care or treatment pathways, and there is a requirement for the most for more best practice examples. So examples are translated across areas of health and healthcare. There is also an obvious role for such allied health professional leaders to link what is known as standard operating procedures to evidence-based practices. So that's some context really about what came out of the literature relating to theme 1, healthcare science and leadership. Theme 2 was about roles and smarter working and collaboration. So under here, we found that healthcare scientists are involved on average about 80% of all tests and investigations in the National Health Service. There is a traditional sense that scientists have always been involved in the support of healthcare teams, providing test results and validation in pathology or blood sciences as part of secondary care. Understanding economics, and generally economics around healthcare, is quite a difficult modality to understand, but understanding economics, at least in some contexts, and smarter working initiatives would streamline care for example, those suffering with chronic kidney disease in primary care. At present, however, the evidence base for collaborative working, where healthcare scientists are physically involved, is actually insubstantial. These AHPs, or allied health professionals, are not traditionally patient-facing professionals, and healthcare sciences as a hidden, open quote, close quote, as a hidden service remains largely unchanged, and cross-profession collaborative working is actually still quite questionable. So some context there around theme 2 on roles, smarter working and collaboration. Now theme 3 theme 3 is around chronic kidney disease and primary care education. So professional integration has been highlighted in several papers relating to the care of patients with long-term conditions, and chronic kidney disease being one of them. Where there is a gap in healthcare professional and in healthcare and professional integration is scientists' involvement at face value in the care of patients with long-term conditions. Now, modern healthcare is delivered by teams rather than individuals, and it requires momentum of healthcare professionals from various disciplines. It is also understand that failures in professional integration and teamwork lead directly to compromised patient care and inefficiencies. Professional integration is as much as about smarter working as it is about professionals developing best practice. There are multiple interfaces and multiple interfaces, and also multiple guidances and frameworks that where route of patient care between members of the healthcare team have been documented and is needed for safe and effective practice. So theme 4 was about skill mix. So healthcare scientists are trained to have a good level of skill set mix to apply knowledge, fulfill test requests, audit, validate, and authorize investigations, at least those that come through through laboratory practice. And what is presently witnessed in most National Health Service laboratories today is a systematic reprofiling of skill set mix in the laboratory. Most laboratories are now employing more support staff. For example, laboratory assistant and associate practitioners, and generally speaking, where laboratory assistants and associate practitioners are involved, there's different gradings in relating to salary as well. This systematic review doesn't look at the economics specifically enough to talk about the sort of the salary aspects of this, but suffice to say that in preference to most laboratories again have been or now employing more support staff in preference and overqualified specialist scientists who are trained to apply skill base across pathology, and these professionals have actually been downsized, and this means that there are now more issues, or have been issues relating to staff cover, time delays, access to more qualified staffs, processes being compromised, more risk management, and general culture and realignment issues. Less experience to lower caliber or cadre sort of laboratory support staffs are also required, but are also required to carry out tasks for which they are not trained for sometimes. Although albeit a qualified healthcare scientist would oversee the works of lesser grade staff, and however, so laboratory staffs are required, and to carry out tasks which they may not be licensed for, or certified, or trained, or qualified, or completely competent to perform. However, that being said, qualified professionals in laboratory practice oversee that work. So generally, those who are qualified would be the ones who could potentially be, for example, could potentially be struck off if there are errors in providing inaccurate in providing incorrect or results around certain tests and investigations. So theme five looks at barriers to sort of integration. So several health professionals, several health professional bodies worldwide have have come out of recent statements to define roles and the characteristics of several team of a successful team, or what defines or a successful a successful healthcare professional team. Patients are undoubtedly interested in self-care, and must be part of the communication process too. Early involvement has also been shown to minimize errors and potential adverse events. There is this misconception, at least across chronic kidney disease, where it's a disease process that occurs in older age, and thus label a chronic kidney disease, open quote, close quote, CKD, can induce fear and is stigmatizing for patients. Patients will benefit from one in this context. Patients can benefit from one-to-one consultations with healthcare scientists. And by the way, healthcare scientists, although may not be patient-facing healthcare professionals, one thing that healthcare scientists professionals healthcare scientists do and have is because of the surmountable amount of sort of terminologies that come across in areas of scientific practice. There would be benefit for patients to have one-to-one consultations with such healthcare professionals in primary care to help provide understanding of particular disease trends. Professional integration will enhance patient access to care, and with new healthcare initiatives on the horizon, facilities could be utilized further, allowing to have more clinical involvement based on community need. Now, healthcare scientists will have to become acquainted with these to ensure services are integrated, supporting of care of CKD patients, and it is actually a responsibility of the healthcare scientists and that profession to provide the public with new knowledge, and this too is important. And this too, providing new knowledge or understanding is important in primary care. At present, however, healthcare scientists are not integrated or have not been integrated into the care of into the care of chronic kidney disease patients, chronic kidney disease and chronic kidney disease patients effectively, and they are historically a health profession that has been at the back of healthcare. Now, I'm going to talk about the sort of critical analysis, and align this around what is known as the Prism diagram, which is an illustration of how the literature was systemically retrieved by papers that were identified, screened, and looked through by their eligibility, and where ultimately they were included in this research. So one of the main figures, this Prism illustration in this poster presentation highlights that from 1,652 papers in the first instance through several databases. 1,634 papers were cross-examined and duplicates were removed, and then from the 1,634 papers, 80 papers were further scrutinized after taking out duplicates for integrity, relevance, and according to the grouping of terminologies, again, healthcare scientists, diagnostic, screening, and primary care, respectively. Records and guidelines, frameworks, policy reports that did not have a focus on particularly apart from the different grouping of terminologies, that did not have a focus on healthcare science and modernization, guidelines, frameworks, policy reports, and focus on long-term health conditions and the National Health Service were further removed, and that totaled to 16 papers, or 16 sorts of literature. So full text articles and reports further assessed for eligibility from that. The number was 64, and then further articles, full text articles were excluded with reasons, with appropriate reasons. The full paper around this work has. The full paper has been accepted for peer review publication, and the full text articles excluded with reasons are highlighted in the full paper publication, but the number around that was 46, and full text articles and reports further scrutinized using the critical appraisal skills program tool were used in doing this. And the remaining numbers of papers that were included remaining included 18 papers, and again five themes were derived from that, as mentioned, and I read out the 5 themes before. Part of this as well, as I mentioned, there was a critical skills critical analysis around this. So patients seek understanding of laboratory tests and information through online support groups, web portals, and even smartphone apps, and often this is non-evidence based, or has been, at least historically, to some extent. Health literacy is and can be a barrier, and studies inform online portals online portals are not currently designed to present test results to patients in a meaningful way. There is literature out there, and from renowned authors that say that online sort of support groups, for example, are not used by patients. Are not used by patients in a meaningful way, and so little is known about patients' understanding of results received through electronic patient records, albeit what is shared through patient electronic records or electronic patient records is comes from a numerical basis. And so having access may not guarantee that patients know how to utilize this context. Patients and carers still want more face-to-face understanding of test results, or at least have professionals be part of online support group discussions where they can where they can receive more rounded care. And there is literature that highlights that. We're providing patients with access to laboratory test results through electronic patient records is advantageous. It is actually insufficient by itself. And let me read this again, because it is quite important. So whilst providing patients with access to laboratory test results through electronic patient records is advantageous, on its own it is insufficient by itself to meet patient requirements, because the main reason is, although literature hasn't really sort of full blown said this in the literature. The main reason is that the interpretations around the test results and investigations differ from one individual to another. So to facilitate what is known as patient interaction or interplay, this sort of step could be or should be accompanied by strategies to support patients interpret and manage test results. There is a document or a framework that talks about what is known as what it has been referred to as digital scientists. So digital scientists might be another progressive proposition where healthcare scientists could be involved through online consultations with patients, providing basic science of tests and basic science of tests for patients to prompt what is known as shared decision making. And there is more scope where healthcare scientists can be professionally integrated into primary care to support best practice, bringing service for patients with chronic kidney disease closer. So I'm now going to just highlight some aspects around what part of this work relating to the strengthening practice. So the avenue, this avenue could open doors to involving scientists more so on the front line, supporting care more for patients with long-term conditions. With an increasingly growing older population and patients with multiple comorbidities, the need for healthcare scientists in primary care to support practice on the front line, providing consultation services relating to disease trends could become important, owing to patients with long-term conditions being prompted to self-care. This will lift further technical burden of GPs, and let me say that again as well. This will lift further technical burden of GPs. GPs or general practitioners, whilst they have a basis around clinical medicine, generally speaking, GPs are not trained to implement their scientific knowledge. And so let me say that again as well. So GPs, general practitioners, clinicians, and clinicians, whether in primary care or secondary care, are not trained to implement their scientific knowledge. So generally speaking, having the need for healthcare scientists in primary care to support practice on frontline, providing sort of consultation services relating to disease trends could become more important, owing to patients with long-term conditions being prompted to self-care. So at present, there have been numerous studies. Studies relating to exchanging chronic kidney disease and estimated glomerular filtration rate thresholds for different stages of disease between laboratories and primary care. Whilst this has been extremely encouraging, prompting collaborative working is actually needed to better the care for patients in community. So I'm now going to just highlight a little bit around the summary of this systematic review. So apart from highlighting what I have done through what is known as the Prism illustration, the summary of the systematic review more generally is that patients suspect or high risk or confirmed chronic kidney disease not only need to access test results, but actually need the knowledge behind them. The understanding provided by healthcare professionals relating to laboratory tests and investigations can be confusing. Patients see many members of the multidisciplinary team at varying times and can receive misinterpreted or misinformed test investigations and results. It could be important to see if scientists' involvement can provide more real-time laboratory test facts and understanding of disease trends with an emphasis on baseline science. So that's this context. There is then primary care teams still have issues relating to baseline knowledge and understanding regarding chronic kidney disease and a long-term condition, despite access to frameworks and guidelines involving scientists to monitor disease trends, providing suspect and high risk patient-centered understanding is being encouraged. There is a need for a review for current workforce planning and consideration for professional integration, at least in the United Kingdom. Professional integration could open doors for involving scientists more on the front line as part of an update on a clinical pathway for chronic kidney disease. So the conclusions around this are thus. So chronic kidney disease monitoring in primary care could be delivered involving healthcare scientists at least in an educational and supplementary capacity, who have robust knowledge of chronic kidney disease laboratory investigations, reducing unnecessary test requests, and streamlining the chronic kidney disease pathway with where referrals are concerned. This could also support, especially where clarity on timing of test requests and quality assurance of investigations are required. There is scope for education service development initiative focusing on allied health professional involvement, but there needs to be there needs to be a coordinated effort between patient interaction and service providers. So thus to understand where this can complement and improve chronic kidney disease care to focus education aligned to, for example, the Renal Patient Support Group, the RPSG, and where the RPSG have developed a preliminary sort of point of care education pathway. And in this poster presentation, there is an illustration around the point of care education pathway, and then aligned to that or linked with that is a proposed guide or algorithm to assess chronic kidney disease patients for advice and educational support based on particular scenarios. And this poster presentation provides an illustration around that as well. And so in line with this, initial research follow-up has also prompted collaboration to the development to the development of what is known, what has also been aligned with this work, at least in the background, is the co-development of 2 chronic kidney disease art book productions. So healthcare is deemed more integrated between primary care and secondary care health sectors. The CKD art books can support wherein patients and carers and health professionals document healthcare according to themes. The themes and educational context with art prompt service users and providers to document in following as part of discussions with peers and health professionals. The art book productions have also been co-developed, integrating collaborative efforts and perspectives between the renal patient support group, the RPSG, and the kidney disease and renal support group, or KDARS, KDARS for kids, social media platforms. And collaborators between academia and healthcare practices. So education, with this educational educational modules should be or could be delivered between patients and allied health professionals, and these can be linked through patient online support groups integrating chronic kidney disease care pathway, so that public health awareness and research meet practice excellence. And so this poster presentation sort of highlights the systematic review in a summary. The full citation for this work is by Mohammed S.N., healthcare scientist in primary care, and again titled is now the right time for healthcare scientists in primary care, systematic review. This was published in 2020, and it was published in the American Journal of Biomedical Science Research Journal, I believe. That's an overview of this particular presentation, and this was done on behalf, in line with the Renal Patient Support Group, and one of the poster presentations that was accepted for the International Paediatric Nephrology Association conference that's set to take place this year in 2022. I want to say thank you for allowing me the opportunity to provide this overview, and feel free to go through this again, and using the timestamps, and like with many of the other presentations that are available through the RPSG, you can use the timestamps to take notes around different aspects of healthcare around chronic kidney disease. Thank you again for listening.